Knock, knock. Can I come in? You must be my 3 o'clock appointment. Is that correct? Great. Well, my name is Dr. Mish. It's super, super nice to meet you. Now, I know you're here. I have a little bit of background information, but before we confirm, can you please just give me a brief overview of why you're into the clinic today? Oh, I'm sorry to hear that. Yeah, I've been seeing a lot of that around this time of the year, so it's really common, and we have a lot of stuff to treat it, so no worries. So, like I said, we're going to get you all checked out, but let me just confirm a little bit to make sure you're in the right place. Although I trust you. Okay. Can you spell your first and last name for me? Awesome. And can I get the mailing address for you, or residence? Okay. So it looks like we have street on our form here. Is it street or is it road? I want to make sure we have it correct. Road? Okay. Let me fix that. Alright. And then a good telephone number. Alright, it looks like we have your insurance information. Okay. Lastly, can you just please give me your date of birth? Awesome. Okay, well, you are indeed in the right place, so we're gonna get started. You can just stay where you are. Given the symptoms, we're not gonna have to do anything too invasive. Let me just grab some gloves because I am going to be touching you a little bit, as long as that's okay with you. Perfect. Okay. Alright, so before we get started, I just want to confirm, you mentioned that you're having some chest pains and some emotional distress and kind of some anxiety, is that correct? Okay. Like I said, we've been seeing a lot of this lately. It sounds like to me, and I'm going to wait till I listen to your heart, but it sounds like you might be suffering from a broken heart, which I'm really sorry to hear that if that's the case, and we'll make sure we take care of you, okay? But I don't want to jump to conclusions, so let me get out my stethoscope. We can take a listen, do a little exam, and just see what we have going on, okay? It'll be painless and super quick. I'm going to take a listen. And like I mentioned, I am going to have to touch you a little bit, mostly just to get underneath the shirt and make sure I have a clear access to your chest, okay? Alright, so let me just get under here. I'm going to take a listen here. Great, deep breath in. Deep breath in and deep breath out. One more time. Deep breath in and deep breath out. a sec. Just move it out. Come back in. And then one thing I do want to do as well, just to rule out any other issues, is I'm going to just do a quick look into your mouth and just see what's also going on. See if you have any other symptoms that might be concerning or may signal something else besides a broken heart, okay? Alright, so if you just want to open up, stick out your tongue. Perfect. Hold that. Alright. So unfortunately for you, it does look like you are experiencing symptoms of a broken heart. Fortunately, though, we can fix that, okay? If you don't mind me asking, how long have you been having these chest pains and feelings of anxiety? About a week or two, yeah. So that checks out. We find that patients suffering from a broken heart tend to exhibit symptoms generally 2 weeks to a month before Valentine's Day. But there are a lot of things that we can do to help counteract that. And I'm going to help you, okay? So what I'm going to do is I'm going to prescribe you a treatment plan. It's nothing crazy. And we can actually do a lot of it here on the spot. I'm just going to make a quick note. Okay. Just so that's in your chart. So, the first thing I want to do is, I find that saying some positive affirmations can really help. Are you familiar with positive affirmations? Okay. Alright. Yeah, exactly. So, I'm going to give you one. I have a sheet at the front that I can give you as well with some additional affirmations. But the one that we're going to say right now, just to ensure that you leave feeling a little better, is the following. Okay. I want you to close your eyes. And I want you to repeat after me. I am worthy of love. I am deserving of love. I'm going to do one more time. I am worthy of love. I am deserving of love. What I'm also going to do, I want you to keep saying that out loud. And I'm going to just do a little bit of face brushing, which really helps with stress. You mentioned having some distress, anxiety, and sometimes the simplest sensation can help you feel lighter and more relaxed. Keep saying it. I am worthy of love. that feel? A little lighter, I'm sure. I'm glad to hear that. Before you go, though, I am going to actually give you some medications and some little potions, you could call it, to help fix the broken heart, okay? So the first thing, I have two medications I want you to take. I know these may look like regular chocolates, but they have medicinal properties that'll help with healing the heart and again making you feel relaxed and lighter. You just need to. If you find that your broken heart is still persisting, you can reach out to our office and we can, depending on the circumstances, prescribe you a few more. And these also generally have positive affirmations inside, so take the medication and make sure to read the inside of the labels and say the affirmations out loud. So those are for you, and I'll put these right here for you. And then we're also going to make you, like I said, a little tincture to help with the heaviness on your chest, okay? So what I have here, and this is going to be for you to take, is a bottle with some distilled water. And I'm going to take off the lid so we can add in the elements to make the perfect broken heart tincture. Put that down for a second. I'm going to first add some nourishing body oil. Remember, you're not ingesting this. This is going right onto the chest. And the oils in this are, again, healing, soothing, nourishing. Exactly what a broken heart needs. Okay. We just need a few drops, so let me grab this. What am I gonna do? 2, 3, 4, 5. There you go. You want to smell it. And that's some of the oils that you're smelling. It's not going to be, what's the word? Aggravating on your skin. It's very, very hypoallergenic. Great for even the most sensitive of skins. I'm not a dermatologist by nature, but this has been cleared by our colleagues, so no need to worry. And then the last thing that we're going to add is what I like to call my special concoction. It's safe, I promise you, as a medical professional. I would not put anything in that would be damaging to you or your body. And this will help. It has a nice scent to it that's very, very soothing. And it also has its own medicinal properties, which will help with any congestion, feelings of, again, heaviness, loneliness, sadness. I have a little here. We don't need much. I think right now, yep, 2.5. And we're just going to slowly add that in. As you'll notice, there's not really much of a tint to it. Very, very, very light. But that's exactly as intended. You don't need much. And so I'm going to get the lid back on. And then this is yours. And what I want you to do with it is, I want you to put a small amount in the palm of your hand. And then I want you to liberally apply it all over the chest, the collarbone, neck, anywhere where you're feeling that heaviness, okay? I would do it for 3 days at least. Gauge. This is enough to last you, generally my patients, for about 2 weeks. We find that you don't need more than that. And honestly, 2 weeks is pretty generous, but you have up to 2 weeks of allocation here. And like I said, 3 days minimum, gauge it, and then just apply as needed up till the 2 weeks. If you need 3 days, amazing. If you need 10 days, also totally fine. 14 days, whatever you need. Every broken heart is different, so we want to make sure you have enough time to heal. I'm going to put this with your medicine. Now, do you have any questions for me on anything before I let you go and enjoy the rest of your day? Great question. So, like I said, once a day with the tincture. I would do it personally. I like to do it at night. In terms of application, at least recommending that to my patients, because I find that it is the most relaxing time. It's nice to do it right before bed. You can get into bed, let it kind of absorb, soothe you, calm you. But as long as you're doing it daily, there's no right or wrong time to apply it, okay? And then for the medication, I would take that tonight when you get home. Yeah, take both of them at the same time. It's more of, I don't want to say a temporary fix, but it's meant to kind of hold you over until the tincture starts to work. But like I said, if you find that you need more, give us a call. We can evaluate and see if we need to prescribe you a couple more, okay? Okay. Any other questions that you have for me? Again, yes. Affirmations, also do those daily. And like I mentioned, I have a pamphlet for you up at the front desk when you check out. So please make sure to grab that, because I want to make sure you're equipped with all the tools you need to help. And you can say those, honestly, way past the 14 days. You could say it daily for the rest of your life if you want. It's just a nice tool to have if you're feeling heavy, sad, lonely. It's always important to know that you're loved, right? Because you are. Whether you think so or not. Anything else? Okay, well, you have everything you need. You have the tools. And I really, really, really think that you can kick this, whether you believe so or not, okay? And we're always here if you need someone to talk to, if you need any additional resources. I know Valentine's Day can be tough, so hopefully this helps, okay? Right. It was lovely to meet you. We'll take you up to the front, get you checked out, and we'll see you as soon as you feel you need to be seen. We're here for you always, okay?